What is up, y'all? This is Journey to Dr. B with the DMD. Hope you've seen my other videos in the past. I enjoyed making these, and today we're going to do a video on the skull and learning about the different features of the cranium. We're going to start with surface level, and then we're going to get to all the different foramen on the cranium. So let's get into it. All right, so first we're going to start off with the general structures of the cranium. As you can see here, we have, this is the frontal bone. It's this area around here. You can see lined here. And next we have the parietal bones. Parietal bones are on the side from here up. It's a parietal bone, and it's the same on the other side. And that's a paired bone, so it's on both sides. And then next we have the occipital bone. That's on the back. So on the back side, you can see, so that's on the back side. The occipital bone right here, as you can see, it goes underneath all the way around here. That's the base, the occipital bone. It goes around there. And next on the side, we have the temporal bone. It's the temporal bone right around here. That's the zygomatic process of the temporal bone. And all along here. And so we'll get into some of these more detailed features, like the external occipital protuberance right here, and the foramen down here in the bottom. So next, let's go into, before I go on there, you can see this is another portion of bone right here in the corner right here. This is the sphenoid bone, and specifically it's a greater wing of the sphenoid bone. And we'll get into more of like the facial bones of the face. And then let's get into the bottom features, the base of the skull. So right here, this is the jugular foramen. We talked about that already. These two little notches right here, those are the occipital condyles, and your C1 vertebra, the atlas, attaches to those condyles and allows you to nod your head like yes, like yeah. And then more lateral on both sides, you see these two holes, foramen. Those are the jugular foramen. And you have cranial nerves 9, 10, and 11 going through those foramen. And more just slightly, I don't know if you can see it, number 21 is right there, right in front of the jugular foramen, more anterior to it. That's the carotid canal. Your carotid artery passes through there. And then more, let's see. So more anterolateral, you have the foramen spinosum, and then more anterior to that, you have the foramen ovale. And the foramen spinosum is important because you have the middle meningeal artery running through there. Artery and veins And that's important because at this portion of your skull, this little area right here between all these bones is called the pterion. That pterion is really soft, and if you were to have an injury there, you would damage the middle meningeal arteries and vessels, and that could cause massive epidural hematoma in the brain, in the neurocranial cavity. So looking more anterior, you have these two openings right here. Those are called the choanae. That's the openings to the posterior opening to the nasal cavity. You have the medial pterygoid, you have the lateral pterygoid right here. And off that is the, this is the palate. You can see that, this is the palate. And then you have the greater palatine foramen and the lesser palatine foramen. So this would be, this area generally would be where the soft palate hangs off and it's more soft. And up here in front, that's the incisive fossa up there at the top, that hole that's important for nerves running through there, innervating the palate of the maxilla. So let's get into the face and the visceral cranial cavity or compartment. So right here you see this notch. This is the supraorbital foramen. And this is the we'd have to go into the cavity first before I talk about that. So let's go ahead and do that. Let's go into the inside. All right. So inside you can see a lot more features. This is the anterior portion of the skull, and this is the posterior portion of the skull. Right here, you have the anterior cranial fossa. And I was going to say earlier that this is part of the anterior cranial fossa. This right here, hanging off, you can see that. That's the crista galli. It's where your cranial nerve one is, your olfactory bulb, and where you get your sense of smell. You have your ethmoid cells there. So there's the ethmoid bone right there as well. This is the sphenoid bone. So you have a greater wing right here. Lesser wing, and a greater wing right here. This is the sella turcica. You have a dorsum sellae, and in here you have a hypophyseal fossa, and right in that fossa you have the pituitary gland is sitting in there. And these two holes right here, you can see in there, that's the optic canal. You can see it goes through to your eyes. And then more inferior to that, you see there, it's hard to see from this angle, but right underneath there, that's the superior orbital fissure in there. And you have a cranial nerve 5 going through there. That's the ophthalmic division. And then more inferior to that, you have the I don't know if you can see this notch, but it's number 44, I guess. There's supposed to be a hole there. It's hard to see, but that's supposed to be foramen rotundum. And you have your cranial nerve 5 also going through there, but that's the maxillary branch of the cranial nerve. And then this hole right here, that's back to that other one that we were talking about, foramen ovale, and cranial nerve number 5 is also going through there, and that's the mandibular division of cranial nerve number 5. So yeah, and then so we had talked about the anterior cranial fossa. The middle cranial fossa is right here, goes all the way back, and then back to the sola turcica area, and then along this petrous ridge of the temporal bone. So right there. And then you have the posterior cranial fossa. That's all the rest. Even includes the foramen magnum. And so, yeah, let's get back into the face. So the face, you have the nasal bones. There's a paired bone. You have one on this side, one on that side. You have the lacrimal bone, and that's a paired bone as well. You have one on each side. That's the ethmoid bone right there on the inside. You have your superior orbital fissure, optic canal, inferior orbital fissure, and then deep down below, inferior to that cavity, orbital cavity, you have another foramen. That's the infraorbital foramen, and you have the maxillary division number 5 going through there, cranial nerve number 5. And so we go down, we have the maxillary bone, then you have the alveolar process right here where the teeth go into, and then you have the mandible. It's this entire bone. You have the temporomandibular joint, and posterior to that you have the external acoustic meatus, and so this joint is super important in dentistry. This joint does all our movements of mastication, chewing, so a lot of muscles attach here, 4 muscles of mastication, and those muscles will, if you guys are interested in these videos, I can talk about that in another video. So yeah, this is the condylar process. This is the coronoid process. And I don't know. Oh, I didn't talk about it. This is the zygomatic bone right here. This is zygomatic. Mental foramen right there. And this would be the mental protuberance or mandibular symphysis right there. It's supposed to be the middle part of that. This isn't as detailed as we need to know, but there's this is another important structure underneath on the inferior internal side of the mandible. You have the lingula, which protects this opening, and this opening is called the mandibular foramen. And you have the inferior alveolar nerve going through there. So yeah, if you guys like these videos, let me know. I enjoy making these videos, these interesting anatomy videos. I enjoy anatomy. I like it. I like to share it. So let me guys know what you think. And please hit that like and subscribe button. It helps with the YouTube algorithm. Helps me move on in the charts. And yeah, I appreciate you guys. So thanks for watching. All right.